Chapter 9, which goes over mental and emotional problems. First thing we're going to go over is mental disorders. So, almost everyone experiences periods of sadness, anxiety, and anger. For most people, these feelings are short lived. For millions of others, however, these feelings persist for weeks, months, or even years. If such situations affect a person's behavior or daily activities, he or she may be suffering from a mental disorder that requires professional health services. So, first, let's look at what are mental disorders. Mental disorder is an illness of the mind that can affect the thoughts, feelings, and behaviors of a person, preventing him or her from leading a happy, healthful, and productive life. People who suffer from some sort of mental disorder are often identified by their inability to cope in healthy ways with life's changes, demands, problems, or traumas. Each year, about 20% of the US population, which is roughly 54 million people, are affected by some form of mental disorder. Even though professional help is necessary, few people with mental disorders actually seek treatment. Of the 20% of children and adolescents who suffer from mental health problems, only one third receive the help they need. Some people are reluctant to seek treatment for mental and emotional problems because they feel embarrassed or ashamed. Another reason is the stigma associated with mental disorders. A stigma is a negative label or a mark of shame. Misconceptions and stereotypes may prevent some people from seeing mental disorders as a medical condition. However, mental disorders require medical attention just as physical illnesses do. In fact, many mental and emotional disturbances involve imbalances in brain chemistry. The sooner a person seeks treatment, the sooner he or she will be on the road to recovery. So let's look at different types of mental disorders. Mental disorders are classified as either organic or functional. An organic disorder is caused by physical illness or an injury that affects the brain. Brain tumors, infections, chemical imbalances, exposure to drugs and toxins, or injuries resulting in brain damage may lead to organic mental disorders. A functional disorder has a psychological cause that does not involve brain damage. These disorders may result from heredity, stress, emotional conflict, fear, ineffective coping skills, or other conditions. Often, functional disorders are tied to disturbing events in childhood, such as abuse, serious illness, or the traumatic death of a close relative. These disorders may also be tied to recent events such as divorce, economic hardship, or natural disasters. So let's talk about anxiety disorders. About 4 million Americans suffer from anxiety disorders, which is a condition in which real or imagined fears are difficult to control. An anxiety disorder is characterized by chronic fear. People with anxiety disorders often arrange their lives to avoid situations that make them feel anxious or fearful. Anxiety disorders can be classified according to four main types: phobias, obsessive compulsive disorders, panic disorders, and post traumatic stress disorders. First, phobia. Phobia is a strong and irrational fear of something specific, such as high places or dogs. People with phobias do everything they can to avoid the object that they fear. As a result, a person with a phobia may be unable to live a normal life. For example, people with agoraphobia have a fear of open or public places. Their phobia may make them prisoners in their own homes. Some mental health professionals believe that certain phobias are caused by childhood experiences. The fear resulting from these experiences lasts far past the actual threat. Next, we have obsessive compulsive disorders. A person with obsessive compulsive disorder is trapped in a pattern of repeated thoughts or behaviors. The term obsessive refers to persistent, recurrent, and unwanted thoughts that prevent people from attending to normal daily activities. Compulsive refers to repeated, irresistible behaviors. A person with obsessive compulsive disorder might, for example, feel the urge to wash his or her hands constantly throughout the day. Next, we have panic disorders. A person with a panic disorder has sudden, unexplained feelings of terror. These panic attacks are accompanied by symptoms such as trembling, a pounding heart, shortness of breath, or dizziness. Panic disorder is a condition in which fear and anxiety get in the way of a person's ability to function and enjoy life. Panic attacks may occur at any time or place, but most are triggered by a particular object, condition, or situation. Next, post traumatic stress disorder. Post traumatic stress disorder is a condition that may develop after exposure to a terrifying event that threatened or caused physical harm. This disorder is common after a personal assault, such as rape, natural or human made disasters, such as earthquakes or bombings, accidents, such as plane crashes, or military combat. Symptoms may include flashbacks, which is a sudden recall of the terrifying event, nightmares, emotional numbness, sleeplessness, guilt, and problems with concentration. The disorder may arise weeks, months, or even years after the event that caused it. Next, we have mood disorders. A mood disorder is an illness, often with an organic cause, that involves mood extremes that interfere with daily living. These extremes are not the highs and lows that everyone experiences, nor are they the mood swings sometimes experienced during adolescence. The emotional swings of mood disorders are extreme in both intensity and duration. So, first, we have clinical depression. Most people who say they are depressed are suffering from a passing cause of the blues. For some people, however, depression doesn't go away. The feelings of sadness, hopelessness, or despair last for more than a few weeks and interfere with daily interests and activities. This type of depression, known as clinical depression, can affect a person's ability to concentrate, sleep, perform at school or work, or handle everyday decisions and challenges. Clinical depression results from a chemical imbalance that a person cannot overcome without professional help. Approximately 19 million Americans are affected by clinical depression each year. Depression often runs in families and can be biologically based, but it can also be caused by life events. Sometimes it may be a symptom of substance abuse or addiction because alcohol and other drugs may affect brain chemistry. We have bipolar disorder. This disorder, also known as manic depressive disorder, is marked by extreme mood changes, energy levels, and behavior. Characteristics of the manic highs are extreme changes in mood, grandiosity, very high energy level, pressured speech, distractibility, repeated high risk behavior. Symptoms of the depressive symptoms or lows, irritability, preoccupation with death, loss of enjoyment, frequent physical complaints such as headaches and stomach aches, low energy level, and dramatic change in eating or sleeping patterns. Although adults with bipolar disorder may behave normally between episodes of extreme emotions, teens with the disorder tend to alternate rapidly between the two extremes with few clear periods of wellness between the episodes. Next, we have eating disorders. Psychological pressures, possible genetic factors, and obsession with body image and thinness can lead to eating disorders. People with eating disorders, such as anorexia and bulimia, suffer from life threatening disturbances in eating behavior. Eating disorders are not a failure of will or behavior, they are real, treatable medical illnesses. A person who suffers from an eating disorder can experience a wide range of physical health complications, including serious heart conditions and kidney failure, which may lead to death. It is therefore critical that a person with an eating disorder get help immediately. Then we have conduct disorders. Children and adolescents who act out their impulses towards others in destructive ways may have a conduct disorder, or a pattern of behavior in which the rights of others or basic social rules are violated. Examples include lying, theft, aggression, violence, truancy, arson, and vandalism. The condition is more common among males than females. Although they may project an image of toughness, people with this disorder usually have low self esteem. They may also have symptoms of other mental disorders, including anxiety, depression, and substance abuse. Without treatment, many teens with this disorder will be unable to adapt to the demands of adulthood, will continue having problems relating to others, holding a job, and behaving in inappropriate ways. Then we have schizophrenia. Schizophrenia is a severe mental disorder in which a person loses contact with reality. Symptoms of schizophrenia include delusions, hallucinations, and thought disorders. Causes of this condition may be a combination of genetic factors and chemical and structural changes in the brain. This disease affects about 1% of the population. Schizophrenia affects both men and women and usually first appears between the ages of 15 and 35. People who suffer from schizophrenia have difficulty understanding the difference between real and imaginary events. This inability leads to unpredictable behavior, difficulty functioning, and lack of good health habits. A common misconception about people who suffer from this disorder is that all of them are violent or have multiple or split personalities. However, schizophrenia people are usually not a threat to others. Professional help and medication are necessary to successfully treat schizophrenia. Then we have personality disorders. The term personality refers to an individual's unique traits and behavior patterns. People with healthy personalities can cope with day to day challenges of life. However, people affected with personality disorders think and behave in ways that make it difficult for them to get along with others. Over the course of their lives, usually beginning in adolescence, they are in constant conflict with others family, friends, teachers, coworkers, or supervisors. About 10% of the population has one of the several types of personality disorder. Counseling and sometimes medication are recommended as treatments. So let's go through some specific personality disorders. We have antisocial personality disorder. People with this disorder tend to be irritable, aggressive, impulsive, and violent. In many cases, they are unable to show remorse for their behavior. Then we have borderline personality disorder. People with this disorder frequently experience a series of troubled relationships. They tend to engage in high risk activities and may have poor self esteem. Although they fear abandonment, they frequently lash out violently at the people they need most. And then we have passive aggressive personality disorder. People with this disorder are often uncooperative. They resent being told what to do, yet they rely on others' direction. Anger over issues of control, they show their anger, but only indirectly. For example, a passive aggressive person who doesn't want to take part in an activity either may forget to show up or may arrive late and leave early. As with mental and emotional problems, it is important to recognize the signs of personality disorders and seek professional help.